Visceral manipulation therapy or VMT is a gentle hands-on technique which improves the mobility and function of the internal organs or viscera. Developed by the French osteopath Jean-Pierre Barrel, VMT focuses on the movement of organs and the impact of this movement on the entire body. VMT is performed when chronic low back pain is found to be correlated with urinary incontinence, respiratory disorder, and gastrointestinal dysfunction. This correlation could be explained by mechanical and neurological mechanisms. Adhesions in the fascia around the viscera can create tension that is transmitted to the musculoskeletal system, leading to pain and dysfunction in the lower back. Viscerosomatic reflex is defined as tension in an internal organ which cause reflexive muscle tension and pain in the corresponding area of the spine. For example, tension in the intestines may lead to increased tension in the muscles of the lower back. Neurological mechanisms include viscerosomatic convergence, autonomic nervous system dysregulation, and central sensitization. The nervous system can confuse signals from internal organs and musculoskeletal structures due to convergence of visceral and somatic sensory pathways in the spinal cord. This can lead to referred pain where pain originating from an internal organ is felt in the lower back. The autonomic nervous system has connections to the musculoskeletal system. Dysregulation of the ANS, often caused by chronic stress and organ dysfunction, can lead to increased muscle tension and pain in the lower back. Chronic pain can lead to central sensitization, where the central nervous system becomes more sensitive to pain signals. Visceral dysfunction can contribute to this process, amplifying the perception of pain in the lower back. Following the line of thought, the state of abdominal and pelvic viscera could interfere with distant body segment mobility because visceral innervation comes from thoracic and lumbar regions through the sympathetic nervous system. The physiotherapist should avoid performing the technique in following conditions. Spinal pathology, example cauda equina syndrome, spinal stenosis, fracture of the spine. Neural compression with at least two of the following signs: muscle weakness, diffuse sensory loss, and hypo or hyperreflexia of the lower limbs. Surgery of spine, abdomen, or pelvis in less than 6 months. Vascular abnormalities such as abdominal aortic aneurysm. During pregnancy, while taking medications that alter visceral motility and increase the risk of intestinal perforation. Having gastrointestinal disease associated with the risk of intestinal perforation, for example, Crohn's disease and ulcerative peptic disease.